You may not have transportation to get to your doctor's office. You may not have the money to pay for childcare, to take time off from caregiving to come to see us. You may not speak the language that your healthcare provider speaks.
We don't realize what we don't know, right? You have a doctor, but you're not accessing what you need.
So access to care is not just your ability to have a health card or to even have a doctor. Access to care means that you're able to feel like you belong in our healthcare system. And that's barrier-free. And a lot of the work that I do at Women's College Hospital in the outreach sector is really around meeting people where they are. We all may start at different places in life, and that is going to affect access to care. And so it's understanding those specific barriers and then figuring out how to get rid of those barriers, which is not always easy. So one of the things that we do, especially in the menopause space, is recognizing that there are many people who are left out of the conversation, who suffer with worse symptoms than the rest of the population. So we know Black and Indigenous women have more severe symptoms, earlier onset of symptoms, yet struggle to access the same level of care. So one of the things that we did at Women's College is we just started our new Indigenous Menopause Outreach Clinic, where we are taking menopause care to the community. And so we are working, understanding that the healthcare system is inherently violent to some patients because of historical issues, and we are a systemic system. And so what we did was we built trust with a community. We co-designed a program alongside elders and the teams that work with this community specifically to find out what the barriers are. And instead of expecting people to come to the hospital to get care, I go out to the community, I meet with people on site, and it's been such a beautiful experience where people are getting care where they feel most safe.